Welcome to the webinar. My name is Stephen Meisterling. I'm an orthopedic surgeon with Twin Cities Orthopedics, working at Osceola Medical Center. Today's webinar is on preparing for your joint replacement surgery. This is a third in a series of 3 webinars. Dr. Zappa has presented on controlling your joint pain, and Dr. Schmiesing has presented on Is Joint Replacement Right for You? This is the third webinar, and I'll be focusing on preparing for your total joint replacement surgery. Thank you for attending. Just a few housekeeping items before we begin. If you could mute your microphone throughout the presentation, that would be appreciated. Any questions can be placed in the chat messaging, and we will answer those at the end of the presentation. And if you'd like the slides, they will be sent out after the presentation to all attendees. My name is Steve Meisterling. I'm an orthopedic surgeon with Twin Cities Orthopedics. I've been in practice for 12 years now and have just recently started my practice in Osceola. I reside in Lake Elmo, Minnesota. I have a family of 6 with my wife and our 4 children. My training involves orthopedic surgery and specifically sports medicine. So I have a particular interest in shoulder, hip, and knee surgery, including arthroscopy as well as arthroplasty and general orthopedic surgery. Today's webinar will be talking about preparing for surgery. If you've attended our previous webinars, you understand the non-surgical options and how to control your joint pain and whether or not surgery is right for you. If you've decided surgery is right for you, you want to know what to expect before, during, and after surgery and make sure that you're well prepared mentally and physically, as well as at home, and how to accommodate your recovery. Being prepared to recover from your joint replacement is very important. You're really undergoing a major surgical procedure, and recovering is a major physical task. The stronger you are and more well prepared you are prior to surgery, the smoother and more successful your recovery will be. We call this prehabilitation. It's good to get in to see a physical therapist and work on your stretching and strengthening and understand those demands after surgery, as well as getting into shape prior to surgery so you can be strong and ready to recover. Talk to your doctor to see if a physical therapy referral is right for you. Your pre-surgery physical therapy will include exercises such as ankle pumps, quadricep sets, heel slides, and short arc quads. These are rather simple exercises, and more complex and customized exercises will be determined by your physical therapist. You'll be going home after discharge from the hospital, and you want to make sure that all of your ducks are in a row at home, that you have a safe and friendly environment, and that you're able to get around and manage for yourself with some help from your friends and family. Important pieces of equipment such as elevated seats and shower seats will be important. You're going to have all of your grocery shopping done and yard work done prior to surgery. Generally preparing for surgery and preparing to be a little bit slow and a little bit weak is important. Prepare your entrances, look out for any dangerous items in your home such as carpet edges, and generally declutter the home and be ready to focus on your replacement and have your home ready to do so. Take a minute to review these recommendations on how to prepare your home for recovery. After your hip or knee replacement, you will require a walker or a cane for ambulation. These assistive devices will be supplied to you by our physical therapist and hospital staff. And once you get home, you'll need other devices such as an elevated toilet seat, a shower seat, or even reachers to help you grasp things. A list of the equipment and devices needed after surgery will be provided to you, and we'll be sure that you're able to obtain these items prior to surgery. I want you to minimize your risk of any complications at the time of surgery. We do that by modifying those risk factors that are changeable. Weight control is extremely important. Obesity is a risk factor for many complications after surgery, and weight control prior to surgery can help limit those risks. Smoking cessation is also very important. Smoking also increases your risk of many problems during surgery and after surgery, and quitting smoking will be essential prior to your surgery. Managing your pre-existing medical conditions prior to surgery is extremely important. Some of these medical conditions are very manageable, including diabetes, anemia, and blood pressure. It's very important to optimize these medical conditions by seeing your primary care physician prior to surgery. In some instances, we may choose to delay surgery until these conditions are optimized. We want to make sure that you're well prepared for surgery from a social standpoint, a physical standpoint, as well as an insurance standpoint. Prior to surgery, you will be required to visit with your primary care physician and get cleared for surgery to make sure that your medical conditions are optimized and controlled. Verifying that your insurance coverage is adequate is very important. We will do that at the hospital, but it's always a good idea to touch base with your insurer on your own. At your preoperative physical, you'll be required to complete lab work and obtain imaging, such as a chest x-ray and an EKG. Prior to any surgical procedure, it's important to complete your living will and/or health care power of attorney paperwork. The day before surgery, we want to make sure that you complete a thorough scrub with an antibacterial soap, and this will be provided for you, along with directions. We do everything we can to provide a COVID-safe environment at our hospital and for surgery. You'll be required to complete a COVID test prior to your surgery. Please take a minute to review these preoperative checklist items prior to surgery. You will be seen at the hospital on the day of your surgery. The surgeon will talk to you prior to surgery, and the anesthesia team will take care of you during surgery. Your actual operation takes approximately 1 to 2 hours, depending on the individual. Your joint replacement surgery will take place at the hospital. Prior to surgery, you'll meet with the surgeon as well as the rest of the surgery team. Anesthesia is typical of spinal anesthesia or general anesthesia, and you'll be very comfortable and unaware of your surroundings during surgery. Surgery itself generally takes 1 to 2 hours, and after that 2 hours or so, your joint will be replaced. The joints are secured and ready to be used the same day of surgery. Getting up and moving and starting your rehabilitation on the same day is very important to restore your function and prevent any complications. Therefore, you'll be ambulating the same day of surgery, you'll be using a walker, and you'll have assistance. Some may take just a few steps and some may take many steps, but getting up and moving and beginning your rehabilitation the same day is very important. You'll stay overnight and typically be discharged the next day, as the average hospital stay is approximately 24 hours. During that stay, we'll make sure that your medical conditions are well controlled and there are no complications or issues with surgery. We'll make sure that your pain is well controlled and that you'll be able to be discharged the day following the surgery with well-controlled pain and safety. We will do our best to prepare you for your recovery after surgery. You'll be discharged at home on the day after surgery, and inevitably, questions will come up. These are a few of your questions. We are available 24 hours a day. If you have any questions, please don't hesitate to call us. If you develop fevers, chills, redness, or drainage, we would definitely like to know about these things. These are signs of infection. Other more serious symptoms, such as chest pain or shortness of breath, are an emergency and can be a sign of a blood clot. Please call 911 with these complaints. You'll be scheduled to see your provider 2 weeks after surgery. Oftentimes, we also see our patients at 6 weeks. If you need to be seen in between these visits, please call our office at any time. You'll be instructed on your post-operative precautions by your physical therapist. You'll be discharged to home with a walker or a cane, and we encourage you to use these assistive devices with ambulation. Particular precautions should be made when getting in and out of bed and getting up and down from a seated position. If you think joint replacement is right for you, or you have any questions about your joint pain and treatment options, we're happy to see you at any time. Please contact us at Osceola Medical Center and make an appointment to see myself, Dr. Schmiesing, or Dr. Zappa. Also, we have an online assessment available at Osceola Medical Center. Please log on to complete this assessment to help determine if joint replacement is right for you. That concludes our webinar. Thank you for attending. I hope you found this informational. If you have any questions, please send your questions through the chat or turn on your microphone now. Otherwise, feel free to email any questions to the email provided. These orthopedic webinars are available online. Please feel free to log on anytime to watch these webinars on demand.